Welcome to Health Hush. In today's topic we will discuss about preoperative assessment for anesthesia. Click the link in the description box for the detailed text to this video. Let's get started. Preoperative assessment for anesthesia. First, let's check what anesthesia means. It means lack of sensation or perception in a person. Under preoperative assessment, we will discuss about two main criteria: history and physical examination. Let's first check out the history of a patient. Under history, we have to assess information regarding the age and gender, indications for surgery, surgical and anesthetic histories, for any previous complications, intubations, and for any history of postoperative nausea or vomiting. Family history, for any abnormal anesthetic reactions, malignant hypothermia, or pseudocholinesterase deficiency. Medications, and about allergies they are known of. And at last, past medical history. Let's keep physical exam aside, and check out the past medical history. Under past medical history, we will assess on all the systems of the body. First, neurological issues. A history of seizures, transient ischemic attack, or strokes, raised intracranial pressure, spinal diseases, and aneurysms. In cardiovascular system, we have to check history for angina, or coronary artery diseases, myocardial infarction, chronic heart failure, hypertension and valvular diseases, for example, mitral insufficiency, or stenosis. Next, respiratory issues. Smoking, asthma, chronic obstructive pulmonary disease, or recent upper respiratory tract infections, and sleep apnea. Gastrointestinal history. Gastroesophageal reflux diseases, liver diseases, and a past condition where nothing is ingested perorally, which is also known as NPO status. History of renal issues. Acute or chronic renal insufficiency, dialysis, or chronic kidney diseases. Hematological history includes anemia, coagulopathies or blood dyscrasia. In musculoskeletal system, arthritis, cervical spine pathology, and cervical spine instability, for example, trisomy 21. Endocrine issues. Diabetes mellitus, thyroid disorders, and adrenal disorders. We also must assess about morbid obesity, pregnancy, ethanol, and recreational drug use. Let's take physical examination back into our place. Under physical examination, we should check onto weight, height, blood pressure, heart rate, respiratory rate, and oxygen saturation. We should also assess on cardiovascular system, central nervous system, and respiratory system. Also, general assessment on nutrition, hydration, and mental status. Airways also must be assessed, for any intubation or ventilation difficulties. Under airway assessment, we should check onto the cervical spine stability, and neck movements. The normal position for cervical spine for intubation is known as sniffing the morning air. Here you can see the extension in the atlanto-occipital joint, in between C1 and C2. And at the second point, you can see the flexion at the lower cervical spine, between C6 and C7. Let's continue airway assessment. We also need to find out which class of Mallampati classification our patient is belong to. In Mallampati classification, we have 4 classes depending on the structures visible when the patient's mouth is open. In class 1, all the structures are visible, including hard palate, soft palate, pillars, and forces. In class 2, pillars aren't visible. In class 3, both pillars and forces aren't visible, and only the base of uvula is visible. In class 4, only hard palate is visible. And at last on airway assessment we should check 3-3-2 rule, where the distance between the incisors are of 3 fingers in breadth. The distance between hyoid bone and the mentum is of 3 fingers in breadth. And the distance between the thyroid and the mentum is of 2 fingers in breadth. It will be difficult for intubation when the thyromental distance is less than 3 fingers or 6 centimeters. Or, when the mouth opening is less than 2 fingers in breadth, and in case of anterior jaw subluxation, the mouth opening is less than 1 finger in breadth. Last but not least, we have few more of physical examinations done under preoperative assessment. Tongue size, dentition, and any dental appliances, or loose teeth, that are at risk for aspiration. And also, we should assess the nasal passage, if there's any need for nasotracheal intubation. We can also examine anatomical sites for regional anesthesia, intravenous catheters, and etc. Like and subscribe for more videos like this.